So anything funny we say is going to be on this forever and ever. So anyway, I want to welcome to the call so that you all know who's all on here. So Courtney Hudson is with me. I'm Diane Finnestead Ellis, and Courtney what joined us on October 1st of this year, the first day of the annual open enrollment period that I could talk about today. She is a rock star. So she just graduated from Southwest Missouri State, which is now Missouri State, with her degree in social work. And what we have found is that there is a disconnect, not only in St. Louis, but around the country with the social workers in the hospitals understanding insurance and what insurance policies everyone has. So Courtney is actually the very first person hired as an assistant to help bridge that gap with being a social worker with all the social workers, as well as your particular providers that you have, your doctors that you see, your specialists that you see, that they understand what happens with social work and what's available in the community beyond the insurance. So it's really cool that she has joined us, and she's basically piloting this program for several, she doesn't really know this, for several different agents across the country that are wondering, how's that working out for you, Diane? To see if they need to hire a social worker for their team as well. Many elder law attorneys have social workers on their teams. So I talked to several elder law attorneys, and they said, Diane, what you need is a social worker on your team that understands this, that can bridge those gaps. And yesterday on a call with United Healthcare, man, we found one of those gaps. It was really exciting. So it's just better opportunities for you and everyone across America who's watching what I'm doing in my little team to see if they can do that across the country. It's really cool. So pressure's on, Courtney. Anyway, so who else is on the call? Paige Benet is here in the room with me. She's right across from me, but you can't see her, but you'll probably hear her. She'll probably have some questions. She's also a client. We just have clients on the call with us. So we also have Joyce Bitter. Say hi, Joyce. And then Cheryl Miller, and then also
Oh,
Patty Schoen, and then and Charm just joined us too. Hi, Charm.
It's Charmaine. I don't know why just Charm popped in there. I didn't do that, but it's Charmaine.
Well, I like Charm. I'm keeping it.
Okay.
It's adorable. Anybody that can have the name Charm or Grace or Faith, oh my gosh, that's a lot to handle. Anyway, so we asked Chuck Hargis to join us today, and unfortunately, or fortunately, one or the other, he actually was very busy. Imagine that. So Humana, over the course of this open enrollment, became the go-to policy for both the HMO and the PPO. If you were going to change your policy this year, most likely across America, you have changed into Humana. It wasn't just my clients, it was everyone across the country
Wow.
because these are national plans. So, a couple of things to know the reasons why. Obviously, because nationwide, what you're looking at is that Humana was able to say, yes, you can go see a doctor without a referral if you have an HMO or if you have a PPO. That is not the case with the competitors at all. They have to have a referral if they have an HMO program. Okay. So that was one where that drove everyone to seek other opportunities. So it was one where when when we looked at this, we said, okay, what is the actual MOOP, the max out of pocket for the HMO? And it happened to be the lowest in the country also, which was $2,700 in the total, the one that was the total HMO. So then we looked at the PPO, and the PPO happened to be their one that was the most popular, and that was the Value Choice PPO. They do have a total access PPO, but that one has a higher maximum out of pocket. The total HMO, or excuse me, the total PPO has $3,500 maximum out of pocket with a one-time $350 deductible. That deductible does not apply to your doctor's visit, your specialist visit, your ER, or urgent care. It's all the medical outside of that. So that was very attractive. Now, the difference between the HMO and the PPO is the access to out-of-network doctors. So what you have is in-network doctors are in the HMO. But here's a caveat that is very interesting with Humana. If you have this year, 2026, if you have an HMO and you want to seek doctors outside of the St. Louis area or your area. Now, I state it like that because you guys know that I am based in St. Louis. I have two offices, one in Creve Coeur and then also one in Valley Park. And those are both parts of St. Louis on opposite ends of the spectrum, really. The Creve Coeur office is to have everyone in St. Louis that's north of, if you know St. Louis, north of Highway 40. And then the Valley Park office is everyone south of Highway 40. And we're talking all the way down to Farmington, Cape Girardeau.
Okay.
But and then the other one is all the way north to Troy. But my business, because of you guys say, Diane, you need to have the ability to help my family members in Massachusetts or Wyoming or Montana or Arizona or Mississippi, and help your brothers and sisters and also kids and also even the parents sometimes. You call and say, can you help them? Yes, I can. And I add an out-of-state license. And so I am now in 29 states, but
Mm.
I'm based here. So when I talk about this Humana, these two plans, I'm going to reference the St. Louis plan, but they're versions of these two plans across the country. But I'm going to use the St. Louis numbers to share from. So when we look at that PPO and we look at the HMO, again, going back to that difference, the HMO is, think of it like home. HMO, take that O and move it right in there, and it spells kind of home. So you're in your home network. However, Humana said, if you want to go use the HMO network across the country, if the doctors are in network in that HMO, you can go see them. So what that means to you is if you get a diagnosis that's very, very strong, and it's one where you say to the surgeon here in St. Louis, who taught you? And they say, oh, I learned this down in Atlanta from this surgeon down there. And you say, are they still in business? You can look on the HMO site under providers for the HMO, and you can see if that particular surgeon in Atlanta is in network. And if they are, you can get on a plane and you can go down to Atlanta and you can see them for the same price, and they work on you in the same price as you'd pay in St. Louis. Isn't that amazing?
That
So
is amazing.
a lot of people were really drawn to that aspect of Humana. The same thing exists for the PPO. So the PPO, think of PPO, people out there everywhere. People. You can go see providers in network and out of network. They don't have to be in Humana in order for you to see them. So it's great if you're the kind of person that wants a second opinion. Okay. And you don't necessarily want that opinion to be that of the network. You really want to evaluate, what are they saying to me? And you want the network to pay for that meeting. You don't want to pay out of pocket for that meeting. There's someone else we got to admit. Hold on. Someone just joined us. Pat Elfreak's joining us. Hi, Pat. Okay, she should be coming in. Okay, there she is. Hi, Pat. So thanks for joining us. So we're just talking about the difference of the HMO and the PPO of in general, and also with Humana. So that people out there everywhere that you can see, same thing applies. However, you could use the same pricing structure on that PPO to go see a doctor in Atlanta or in Florida or in New York or in South Carolina or in Kansas or anywhere in it that Humana has a footprint, and they are across the country. So it allows you to go see people for a set price that aren't in the network. And that's both in the St. Louis area, the area in which you live, and then around the country. Does that make sense for everyone? So that's really the difference. So if you're already seeing the doctors here and you have those doctors in network, you can save some money, and everything is a lower price on your copays if you go into an HMO. And I found out yesterday, this was very interesting. One of the broker leaders, he said, Diane, the reason why that PPO is more money is that Humana only has a certain amount of money that we can subsidize. He said that's why we are subsidizing, and everyone subsidizes the HMO. And then it's on the member to make up the difference, to have that choice as a PPO. I said, oh, okay. So it's harder to predict what they're going to use of that PPO. So it's harder to know on your end when a claim comes in, how much claims time they're going to use and how much you have to pay the staff in order to keep that PPO running. He goes, you got it. He said, that's why the companies prefer the HMO, because we can control the costs, and we can predict how much someone is actually going to use it. I thought, okay, great. So PPOs are good for a member and not so great for a company. And he goes, well, not exactly, Diane. But that's how it translated to me. So we'll see what happens with the PPOs next year in 2027. And that was my other question. And I said, well, when do you all make that decision for 2027? And they rolled it out for me and said, Diane, our first draft goes into place April 1st. That's when we have our first draft of our plans for 2027. Second draft comes out July, and then we can make changes to that draft up until October 1st, the first day that you can talk to your clients. And I went, can it be
Yeah.
sooner? And he said, that's why. He goes, you've been smart. He said, July is when you start reaching out to your clients, really calling them and saying, what's changed this year? What do you need for next year? We're going to have education classes. He said, you're one of the only people in America, especially in this area, that does the 12 education classes to make sure everyone knows what's happening with all the plans. And I said, oh, could you say that a little louder, please? I love that commercial. So he said, well, I'm going to give you another commercial. And I said, what's that? He said, Diane, you need to tell your clients and they need to tell their friends that they need to look for that ANOC. And I said, oh, we hate acronyms. And I said, what's the ANOC? And he said, it's the actual annual notice of changes that comes to you in the mail. And that is, it'll come to all of your mailboxes, probably September 15th through October 15th. And a lot of you, when you come to my classes, the education classes about the changes for that year, you bring your ANOC with you, your annual notice of changes. And this past year, I told him, I said, we don't like the one that just shows the changes from one year to the next, and it doesn't list everything. I said, we want it to list everything, even if it's the same. We want it to list everything. He has noted. He said, I will take that to the meeting. And he said, and I will make sure that they hear that as of April 1st. And I said, it's not that much of a difference in paper to put everything down and say same, 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 and then show what it is. So with that in mind, what I want to let you see here is what I have in front of me. So many of you have either, the majority is, and if you can see this, this is the HMO, and it is the total complete HMO, and the number on it is, it's in select counties in Missouri. This is the one we're going to use, and it's H4461-046-000. So what I'm going to do is, if you all give me a thumbs up or you put it in the chat that you would like for me to send you the enrollment book, hard copy, I'm happy to send it. But I'm also going to tell you that if you want it electronic and save me the cost of the stamps that are now $1 million, then I will send it to you electronically so you can see this. But what I want you to hear is a couple of things in here, and that way you can know what you're looking at. So we're going to just do the HMO line by line. And I don't know, Courtney, can we share a screen? Can we actually have this in there, or do we have to have it on the slide?
You have to have it like on the internet.
Okay.
I mean, I can take pictures. Email it, pull it up that way if you want me to.
Do y'all want to look at it while I'm talking about it? Would that help, or do you want me just to talk about it? Give me a thumbs up if you just want me to talk about it.
Hey, Diane.
Yeah.
Can you hear me? This
Yeah.
is Cheryl.
Yeah.
I'm on the PPO plan. Does this meeting only apply to the HMO plan?
Nope, it's both.
Okay. All right, then I'll hang in there.
So what we have with the HMO, it's a $2,700 maximum. And then what happens is when you're inpatient in the hospital, then it's $375 a day, days 1 through 7, and it's a zero copay from day 8 through day 90. Diagnostic colonoscopy, diagnostic mammography is a zero copay. Surgery services outpatient are $300 copay. Ambulatory surgery center, if you go there instead of the hospital, then the surgery services are $200. So you save $100. And then the doctor's visits, the primary care is zero, the specialist is 25. Telehealth for primary is zero, and then also the specialist is 25. Now there is a huge listing of preventative care in the medical benefits. And in this particular summary of benefits, it's page 5. And it lists all the different things that you can ask your provider, your primary care or specialist, that you can get for free. Now, I will tell you, with preventative care, your doctors are not going to overload you with preventative care. Why? Because it doesn't cost anything. But if you ask them, it goes in your medical record that you ask, guess what? You usually get. Imagine that. So always ask. You need to know what's on that list. And then emergency care services at the emergency room, it's only $130 copay. The lowest price for the under 65 right now in our area for the marketplace, in case you're wondering, the under 65, the minimum to go to the ER is $500. Y'all have earned some really, really good benefits. So thank you for working your 40 quarters. Okay, so we have urgently needed services are only $65 with telehealth or the urgent care. And then also you have the advanced services, and then you also have the hearing services. So that's all I'm going to go over with the HMO. Now I'm going to do a deeper dive into the PPO, what you all have been waiting for. Dun, 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 dun. Okay, so as I look at this, and you have your out of network that you have, so I will concentrate on that for you. Now, one of the things that they want you to know about is the over-the-counter mail order allowance that you have, and I will go over that. So everyone always asks me, how does it work, Diane? So you need to visit Humana. So it's huma.na /docs dash forms. I'm going to say that again. Huma, HUMA .NA /docs, DOCS dash forms, or you can scan the QR code, which is in this book, to your tablet, and then you can view the OTC wellness products catalog for 2026, and it's already available for you. So some of the things that are on there: allergy medicine, antacid, heartburn relievers, aspirin, bandages, cough suppressants, also denture cleaners, multivitamins, OTC hearing aids, as well as pain relievers and sunscreen. So that's just an idea to give you that. Now, if you want to see the online catalog and you need to request a printed catalog, you go to the Centerwell Pharmacy, and here's the number. It's 855-211-8370. I'm going to repeat that. It's the Centerwell Pharmacy, and you can request a printed catalog. It's 855-211-8370. So this is the Humana Value Choice H7617-023 PPO. Isn't that exciting that it makes you feel like we're talking about C3PO from like Star Wars, doesn't it? When you read it. Anyway, again, it's the Humana Value Choice H7617-023 PPO, Missouri, Illinois. Edith just stepped into the room. Come on over here and wave to everybody. She looks so cute. So, okay, say hi to everybody, Edith.
Hi, Edith.
Hi, Edith.
They're all
Yes,
like,
you do look cute.
So she just wanted to say hi to y'all. So
We love you, Edith.
she loves you more. Oh, I love it. Okay. So understanding the policy, let's kind of get in here so that you can see, to be eligible, you guys are all eligible because you have the A and the B, and you know the plan name. Here's how to reach. If you're a member of this plan, you can call toll free. Here's your number. You ready? So it is 1-800-457-4708. And if you're bragging about your plan to your friends, have them call me first. Don't call Humana, but they do give them a number too if they're not a member, 1-800-833-2364. But have them call me. My number, 314 302-5743. I love your referrals. Thanks, you guys. All of y'all have sent friends my way. Thank you so much. So more about Humana PPO. So it talks about a healthy partnership. Get more from this plan with extra services and resources provided by Humana. So after I go through your particular description, I'm going to go through those extra services because I will say Humana was the very first company in our area in St. Louis to have an OTC program. They had this program all the way back to 2014. So they were the first company to offer the OTC, and so it's really a well-oiled machine once you start using it. Okay, so the monthly plan premium is 0. Part B reduction is $2. Okay, so what does that mean? So a lot of people called me and they said, Diane, you said my Part B was going to be $206.50. It's only it's 204.50. What's going on? Well, you'd think everybody'd be happy about an extra $2. They didn't know where to put the $2 in the plan, so they just gave it back to you.
Oh.
So that's all they did. I told them, I think you're up to something. I think that you are seeing if people call in and actually like getting some money back because you might increase that next year, right? They said, oh, Diane, you can dream. And I said, oh, come on, I think I'm onto something. And they wouldn't let up, but they smiled. So we'll see. Maybe I'll get more money back next year.
Nice.
Yeah, we'll see. We're going to pay attention to that $2. So, okay. So then the medical deductible is $350, and that is combined with the in-network only, and you'll see it with the ambulance services, chemotherapy, drugs, continuous glucose monitors, diabetic monitoring supplies, as well as diagnostic mammography, durable medical equipment, lab services, other Medicare Part B drugs, outpatient blood services, primary care, and specialist offices, as well as both in and out of network emergency room services, Medicare covered preventative services, Medicare Part B insulin, and also you would see the services not covered in original Medicare, supplemental benefits, and urgently needed services and urgent care services. So you may see the $350 deductible, or you may not. So just know that you might see that. And then the pharmacy Part D deductible is $615 when you're in tiers 4 and 5. So when you're in the specialty tier of tiers 4 and 5, that's when you're going to hit that $615 deductible. Now, what's interesting with this particular drug plan, the tier 1, tier 2, and tier 3, those are $0. So you don't have, I mean, a 0 deductible. You do not have a deductible for those. So many drugs moved into that tier 3 column this year with Humana, which made that Part D much more attractive. The maximum overall that you would have to spend on drugs for this year is $2,100 in any drug plan with any company, and that's for drugs that are on the formulary. If you start taking drugs that are off of the formulary, you start getting specialty drugs, that's when you send me a text and you say, hey, Diane, can you help me with this? One thing we can do is we can appeal it through the company, where you call customer service and you say, how do I appeal this? And typically what happens is you will tell them that you say, I have a letter from my doctor that says this is medically necessary, that there are no other substitutes for this drug, and it is not elective and it's not cosmetic. And that's what they need to see in order to assign it a tier level. But sometimes when they assign the drug a tier level, we can still do an outside search and see if that drug is available through programs like Cost Plus Drugs that Mark Cuban has, or the Canadian Med Store that's located in Tampa, Florida, that's avoiding the tax and tariffs, but still getting the Canada prices. So there's these different nuances outside of Medicare that are available. So you just need to let me know, and I can let you know the next step for a particular drug that doesn't show up on the Humana formulary through Centerwell. Okay, so the other thing to note is inpatient hospital coverage is $375 a day, days 1 through 7, and zero copay for days 8 through 90. And it's a 50% cost to stay in the hospital for a hospital stay out of network. The diagnostic colonoscopy and diagnostic mammography is $0, both in network and out of network. Surgery services are $300 copay for the outpatient hospital, 50% outside of the network. And then again, you save $100 if you go to the ambulatory surgery center that's outside the hospital, and that would be a $200 copay for surgery services and 50% of the cost out if you use the out of network. The primary care doctor is $0 in network, $0 for telehealth, and the specialist is $30 for the specialist visit in network and the telehealth visit for a specialist in network. Both of those, the primary and the specialist, are 50% of the cost. And telehealth is not covered when you're out of network. So it's 50% of the cost out of network. You're going to see that 50% starting to represent. If you want the preventative care, again, ask your doctor about that. Sometimes they just don't bring it up, but you can bring it up to them and it'll be in your medical record. And that'll be a zero copay when you have preventative care. And then it's a zero copay also for out of network, but 50% of the cost, depending upon the service and where the service is provided. So if you do want to go out of network, it's a great thing to call Humana, the back of your card, customer service, and ask them if it is in network, or you can go onto your Humana portal that we're going to talk about in a little bit, and you can look it up there. So medical benefits continued. It goes into page 7, and it lets you know that you have a welcome to Medicare preventative visit. If you've just switched into this plan, you have a welcome to Medicare visit, preventative visit. So you want to tell your physician, even if you've had this physician for a very, very long time, you want to tell them, this is my welcome to this Medicare visit with Humana. I have new coverage. And you want to let them know that. That way they can put it in their medical record, and it gives you an additional, typically on average, 15 minutes with that doctor to review things, ask questions, that kind of thing, because Humana has built that into as one of your benefits. Isn't that cool to know? It's kind of nice. So you just have to make sure that they know this is your welcome to Medicare visit. This one's going to be a little bit longer. And so you get that time with your doctor. All right. So the next thing, emergency care in network is $150 copay. Out of network, it is going to be $150 copay. Urgent care is going to be $65, both for the telehealth and urgent care in network. And then telehealth out of network is not covered for urgent care. And then $65 is the same copay for the out of network. So that's fantastic. You don't have to worry about, when you go to any of the urgent cares, because we have so many in the St. Louis area, because we have 5 hospital systems. We're so lucky. We are so lucky. And I say that not sarcastically. That is amazing. And when I go to conferences, everyone's like, you're in St. Louis? Oh my gosh, that's the 3rd area in the country where they want to release plans. Why? Because we have 5 centers of influence with all these medical systems. We have St. Louis University, BJC, which is associated with WashU at Washington University, Barnes Jewish Hospital. And then we also have SSM, and then which also encompasses SC. And then we also have St. Luke's, and then we have Mercy. Oh my goodness. We are so blessed that we have so many wonderful people in this community, not to mention the Alzheimer's Association and all the research that's going on at WashU. So when I go to conferences, they're like, Diane, do you know the broker leaders in St. Louis? That's the top job in America to get. And I said, yes, I do know. So that's, again, so Chuck Hargis is my broker leader. He is fantastic, y'all. So I want you to know I don't work in a vacuum. I am so supported by so many people in order to help you. So, which is wonderful. And every single broker leader from every company is fantastic. And the amazing thing is in St. Louis, they all talk to each other and they're all friends. And they all share things. They don't say that they do, but I know they do. Because when they get together, they do that little side thing. Our plan, your plan. So they're good buddies. So it's wonderful to see. And you don't see that across the country, believe me. So we kind of, the iron sharpens iron in our community. So going on, we have MRIs, PET scans, CT scans. If you go to a freestanding radiological facility, it's $200 in network. Outpatient hospital is going to be $335. A PCP office to have that stuff done is $280, and a specialist office is $280. And again, I'm on page 9 of the schedule of benefits. All that stuff out of network is 50% of the cost. And then basic radiology services, freestanding radiology for x-rays is $65. If you're in the specialist office, it's $30. If you're in your primary office, it's $0. So if you're going to get x-rays, try and get it at your primary, because that's $0. And then if you go out of network, it's all 50%. And then mammography, freestanding facility or specialist office is $0. And then out of network is $0. And then procedures and tests, again, if you have a procedure or a test at the primary office, it's $0. So you definitely want to have your test taken there, or outpatient hospitals 35, specialist office is 30, or urgent care is 65. And then 50% of that cost is if you go out of network. Labs are $0. And then if you go out of network, it's 50%. So if you've got labs, make sure that you're staying in network. You can go anywhere to those places I said: freestanding laboratory, outpatient hospital, PCP's office, primary's office, your specialist office, or urgent care center, all $0 for the copay. And then nuclear medicine and services, freestanding radiology facility is $245 for the copay, and the outpatient hospital is $250. Now, if you need a sleep study at home, it's $0. They love that sleep study at home, by the way. So it's that $0 copay, and then the outpatient hospital is going to be a 20% cost, and the specialist office is going to be a 20% cost for a sleep study. And then if you do out of network, it's going to be 50%. Now I'm on page 12, and in page 12, it talks about, let's see here. I'll skip some pages. So let's go back to page 10. So radiology, therapy, radiation therapy, anywhere you go, a hospital, the office, or a radiological facility is going to be $50. However, the specialist office is going to be $30. So, and then all the out of network is going to be 50%. So let's talk about hearing. Hearing is going to be a $0 copay for 1 year exams. You have an exam every year, $0. $699 copay for the advanced level hearing aid, and one per ear per year. And then $999 copay for each premium level hearing aid, to one per each year per ear. So hearing aid purchases include unlimited follow-up provider visits during first year following true hearing hearing aid purchase. So you do need to go through True Hearing. There's a 60-day trial period. There's a 3-year extended warranty. There's 80 batteries per aid for non-rechargeable models, but rechargeable models, those styles and options are available for premium and advanced aids for additional $50 per aid. Now, you must see a True Hearing provider to use this benefit. So here's who you call. Dun, 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 dun. Drum roll, please. It is 1-844-255-7144 to schedule your appointment. Now, what do they say about out of network with hearing? Hearing aids must be purchased through the True Hearing. Coverage will not be provided for hearing aids purchased from a non-participating provider. So call that number for True Hearing. It's 1-844-255-7144. All right. So dental services. Oh my goodness. This is fabulous because you can go in network and you can go out of network. And all these pricings that I'm telling you are going to be the same, except Medicare covered dental is going to be a $30 copay for in-network and a 50% of the cost for out-of-network. So you want to try and get in-network with Humana to maximize your benefits. So mandatory supplemental dental benefits, limitations and exclusions. So please see your evidence of coverage for additional details. And if you need that, you can go to humana.com/SB. And we're now on page 11. So in-network dentists have agreed to provide covered services at contracted rates. This is important to know because dental can be the Wild West. So they have provided and they have said the in-network dentists have agreed to provide covered services at contracted rates per the in-network fee schedules. And that's called an INFS. If a member visits a participating network dentist, the member cannot be billed for charges that exceed the negotiated fee schedule, but any applicable co-insurance payment still applies. Visiting an in-network provider may result in saving you some money. So this is very important to know. You do not need a referral to see plan providers when you go to the dentist. This plan requires prior authorization for some items and services. And if you want to see a list of items and services that might be subject to the prior authorization, this is at the bottom of page 11, and it says humana.com/PAL, all in caps. PAL, like it's your pal. Your pal's going to give you a smile, and that's going to bring your smile at the dental office. That's how I remember it. So, okay, so this.
Can you say that again, Diane?
Hmm?
Can you repeat that?
Sure. The following link will take you to a list of items and services that may be subject to prior authorization. It's humana.com/PAL. And time to take a little sippy. Okay, so the dental, you're going to pay $0 for scaling and root planing for in-network, $0 for comprehensive oral evaluation and periodontal exam, and then also a $0 copay for bridge recementation, and as well as crowns recementation, as well as panoramic films and diagnostic x-rays up to 1 every 5 years. A $0 copay for crowns and or other restorative services. or care buildup or prefabricated post and care, root canal treatment, up to one per tooth per lifetime. And then a zero copay for bite chew x-rays, as well as other x-rays up to one set a year. Copays for adjustments to dentures rebase, $0 for denture reline, denture repair, emergency diagnostic exams, tissue conditioning, up to one per year, and a zero copay for emergency treatment for pain, oral surgery, periodic and exam prophylaxis cleaning, up to two per year, and a zero copay for periodontal maintenance, up to four per year. Now, again, this is on page 11, and you'll be able to look at that, and then you'll also be able to look and see if any of that needs a prior authorization for the humana.com/PAL. You'll also be able to go into your portal, and you'll be able to find the nationwide network. But you can also find the nationwide network at this location. It is humana.com/find care. Capital F in find, capital C in care. So humana.com/find care. So out-of-network dentists have not agreed to pay services at the contracted fees. So you need to be aware that those out-of-network providers may bill the member for more than what the plan pays, even for services listed with no member cost share. Members are responsible for this difference because Humana's reimbursement and the out-of-network provider's charges have a difference, and this is known as balance billing. So other things to know about. It is $0 for in-network for any necessary anesthesia with covered services up to as needed with covered codes per the year. So again, you would check that for prior authorization. $0 for amalgam or composite fillings, simple or surgical extractions up to unlimited per year, which is amazing. Most plans do not do that. That's unlimited. And then 30% of the cost for bridges, as well as that would be up to partial dental dentures for up to one every 5 years, and 30% of the cost for bridges and crowns up to two for every 5 years. And the combination of all of that is $3,500 combined maximum benefit, covered amount per year for all diagnostic, preventative, and comprehensive services. Then, if you look out of network, it says $3,500 combined maximum benefit coverage amount per year for all diagnostic, preventative, and comprehensive benefits. Benefits received out of network are subject to any in-network benefit maximums, limitations, and other exclusions. So if you want to get the most out of your dental, you would go to a Humana dentist. Now, I will pause and I will say that if you need more dental in the year, please SOS me. That is an SOS. And that means when I turn my phone over and Edith turns her phone over and Courtney turns her phone over and we see an SOS at the beginning of a text, we know we need to call you immediately. That means, oh my gosh, Diane, I have broken a tooth. I've got to go to the dentist. I don't think that 3,500 is going to cover what I need. I need more dental. And then we can look at all the choices. I can get the codes from you. I can look it up with the other companies and I can see, okay, how do we mitigate that cost? Are we going to look at other, Medicare choices, or are we going to look at outside Medicare for an ancillary policy, an additional policy? So, and then I walk you through it and I try and save the day and save you money. All right. So going on, the vision services, eyewear, post-cataract surgery, $0. And then the vision service for that out of network is 50%. So again, you want to stay in the network with vision. And then Medicare covered diabetic eye exam is 0 and then 50% out of network. Medicare covered vision services are 30, and this provider locator will help you find the vision. It's the same one as the dental. It is humana.com/find care. Again, it is, humana.com/find care. And then getting into supplemental, the mandatory supplemental vision benefit. So please inform the network provider that you are part of the Humana Medicare Insight Network. That's your network. So when you go see your vision specialist, you want to say, I am part of the Humana Medicare Insight Network. Note, the network of your providers for your supplemental vision benefits through Humana Medicare Insight Network may be different than the network of providers for the Medicare covered vision benefits. Okay, so the provider locator can be found also on humana.com/find care. So benefit allowance is applied towards the retail price. Member is responsible for any costs above the plan approved amount. Lost or broken materials are not covered. This benefit is limited to a one-time use per year. Any remaining benefit dollars do not roll over to the future purchase, and eyeglass lenses options may be available with the maximum. So it's $0 in network for a routine eye exam up to 1 year, $75 combined maximum benefit, covered amount per year per the routine exam, and $75 maximum benefit coverage amount per year for contact lenses, eyeglass lenses, and frames, fitting for eyeglasses, lenses, and or frames. And then $150 maximum coverage amount per year at plus PLUS capitalized plus provider for contact lenses and eyeglass lenses, frames, fitting for eyeglass lenses and frames. Again, it is a maximum benefit per year of $150 at plus provider, PLUS. Eyeglass lens options may be available with the maximum benefit coverage amount up to 1 pair per year. And maximum benefit coverage amounts are limited to one-time use per year. So you, again, staying in network is going to be better than going out of network. So you want to stay with a plus provider. All right. Now, here's what they say. The maximum benefit coverage amounts cannot be combined. Plus providers are part of the Humana Medicare Insight Network and will display the plus provider indicator in the provider locator search results when you go to humana.com/find care. Yes? Okay, moving on. So anybody interested in mental health? Anybody want that? Okay, so let's get some mental health services. So we have inpatient stay for mental health is $334 a day, day 1 through day 7, and then 0 copay per day for days 8 through 90. And then we have mental health therapy. This is amazing. These rates for mental health therapy, I would run if I could pay these rates. Oh my goodness. Oh my gosh, because the going rate right now to talk to a counselor is $150 for the under 65. Y'all, the mental health therapy visits for outpatient hospital is $35 copay. That's amazing. Specialist office is 30, and then the telehealth is 30. That is just unbelievable. So if you ever need to talk to anybody, oh my gosh, pick up the phone and you can probably talk to someone in 30 minutes through the telehealth, and it's $30. It's great. And then any outpatient substance abuse services, outpatient hospital is $35. Again, the under 65 are paying through the teeth for these services, and y'all earned it. So outpatient hospital Substance abuse services are 35. Specialist office is 35. Telehealth is 30. All of those services are at 50%. And then telehealth is not covered for the out of network. Skilled nursing facility. When you leave the hospital and you go to rehab, this is an interesting thing. This might be one of those things where you call and you say, hey, Diane, we're trying to get an approval to go to a certain rehab. So at different times of the year, different rehabs around our area and around the country are full. And so you can't necessarily get your first choice, or you want to see what's available. I will say thank goodness for Courtney Hudson coming on the team, because I know she's going to be instrumental in helping a lot of the social workers understand how insurance is approved to get you into the rehab facility. And it might not be your first choice because it might be full or might not have the services that you need. But we can talk to, we definitely can let the social workers at the hospital know what your coverage is, and how they can communicate to the insurance side. So when you're looking at a rehab facility, it's 100-day stay. And you think, oh, I can be there 100 days. No, that's not a guarantee. It is based on your plan of care and you meeting your measure markers in order to go to rehab. So a couple things that you can do as a client, as a member, as having Medicare, is you can be in compliance. So if you know, and you're thinking, I am not going to walk in 3 days. They want to see that you walk in 3 days. And I'll tell you why they want to see that before they release you to rehab. If you boomerang back, and this is with any company, this is with anybody that has any kind of medical insurance, not Humana. This is not germane to Humana. This is anybody. If you boomerang back into the hospital does not get paid again if it's within that same period of care for that same reason. So if they let you go to the rehab facility and you were to fall and then you came back to the hospital doesn't get paid again. So the hospital's trying to see that you are going to follow everything that they're going to tell you to do when you go to rehab, and you are gung-ho and you're ready to do everything they throw at you. Even if you're not, play the game. Be gung-ho. I'm gonna walk in 3 days. Yes, I am. And then they're gonna be like, yes, we're gonna work with her, we're gonna work with him, and we're gonna make sure that they're not gonna boomerang back into the hospital. So then when you go to rehab assesses you and they say, okay, we made this assessment while you were in the hospital. Because typically the hospitalist and the physical therapist come in your room and they see how you're doing. Can you walk? Can you move? What's going on? And they usually want you to walk a couple feet down the hall before you're transferred over to rehab. Or they want to see that you are complying and doing everything that they've asked you to do. So you get over to rehab center is trying to make sure that you will do what they've asked you to do, because they're audited based on their ways of rehabbing you within a certain period of time. So if you have someone that rehabs after a hip and it takes 10 days on the average, or it takes 6 days on the average for their facility, if you go 14 days, it's a red flag for them and they can get audited. So you guys have got to, the biggest thing when it comes to rehab is be excited, have a great attitude, play the game, and be compliant. And then they'll say, great, they're going to do everything we asked them to do. They won't boomerang back, and they will meet all their measure markers. So that 100 days is a falsity. So we have, when you're in rehab, days 1 through 20, it's only $10 a day. And then days 21 through 100 is $218 a day. Now, I'm going to just make another little point here. Many of you on this call have extra coverage For rehab, you have an extra hospital indemnity plan that includes rehab. And this is important because you will be able, when you get out of that facility, you will need to contact me, and I'll remind you, you'll need to get a UBO4 form. And so that form allows me to jump in and send in that receipt so that you get a refund back per your policy amount. But that's an extra policy. Without any extra policy, you're looking at $10 a day, days 1 through 20, and then $218 copay per day, days 21 through 100. And if you go outside of the network, it's 50% of the cost, days 1 through 100. So you want to stay in network for sure. And then the ambulance, if you ride an air ambulance, it's going to be 20% of the cost, whether it's in network or out of network. A ground transportation is going to be $335, both in network and out of network. And then transportation in general, like an Uber or something like that, that's not included. There's no transportation with that. If you do need any kind of transportation, that's a call to Courtney, and we can look around in the community and see who would be a contact for you for transportation. So when you look at other benefits, when there's Part B benefits listed in here. Many of you do not need that information today, but if you do later, let me know. And plan highlights with prescription benefits. The insulin costs are at $35 a month. And you can get up to a 100-day supply on eligible drugs, and also excluded drug coverage. There's excluded drug coverage for the following: erectile dysfunction drugs and prescription vitamins are not covered. They will not even consider those. So those cannot be appealed. And there's $0 on vaccines. So if you need vaccines, and this is the vaccine that is recommended under Part D for adult Part D by the Advisory Committee on Immunization Practices. That's ACIP. And if there is an advisory to have that particular vaccine, then it is a zero cost. So you can always call customer service at Humana and ask them what vaccines are current right now that are a zero cost, and then they will let you know. So again, with the drug plan, the maximum that you're going to pay is going to be $2,100 if it's on the formulary. So some of the things to know is if you would like to have yourself or a friend be considered for extra help on the cost of the drugs, the extra help number, you can contact Social Security at 1-800-772-1213, and they're there between 7 and 7. So 7 a.m. to 7 p.m. And you can apply for extra help. So, and then what happens is you're only paying a fraction of the cost of the drugs at that time. And it's a little bit different. You can see it online too on Medicare.gov, and then you can go into the box that asks for questions, and you can put in that box extra help, and then extra help will let you know the parameters for the national parameters, and then if there's any parameters to know for each state or our area. So additional benefits, this is exciting. You have acupuncture services, Medicare covered acupuncture services. So in network, it's and out of network, it is $30 copay for acupuncture for chronic low back pain and visits up to 20 visits a year. And then also, if you're out of network, again, it will state benefits received out of network are subject to any in-network benefit maximums, limitations, and exclusions. So again, you're going to get more coverage. You're going to maximize your coverage in network. So chiropractic services, it's Medicare covered chiropractic services. It's only $15. That is amazing. That's the lowest in the area. And then we have the out of network is 50% of the cost. Podiatry services, Medicare covered services are $30 copay, and then also a 50% of the cost. Again, the podiatry services, um, you definitely want to ask Humana if there's a certain service that you need. Ask them if that's covered, and if they can also use a letter from the doctor to get something covered for you. So this has come up with a couple different clients recently. So that podiatry service is wonderful to have. And then also, if you need a glucose monitor, DME provider is zero, pharmacy provider is zero, out of network, again, 50%. And then we have diabetic monitoring supplies. A diabetic supplier is going to be 20%. A network retailer is going to be 10%. Preferred diabetic supplier is going to be $0. And the preferred diabetic supplier, of course, is not part of the out of network. And then the other two is going to be a 50% cost. Now, durable medical equipment, it's going to be 20%, whether you're in network or out of network. Medical supplies at a medical supplier are going to be 15% in network, 50% out of network. Prosthetic devices and related supplies at prosthetic providers are going to be 20% of the cost, 50% out of network. Rehabilitation centers, cardiac rehabilitation
Okay.
services. Outpatient hospital is going to be 30, and specialist office is going to be 10, and it's going to be 50% for both outside of the network. And then we have occupational therapy, comprehensive outpatient rehab facility is going to be 30. Outpatient hospital is going to be 30, and a specialist office is going to be 30. That's a wonderful price because that's competitive across the board for all the plans in the St. Louis area. Excuse me. And then the out of network is going to be 50% out of network for all three of those places. Now, physical therapy, again, that's going to be $30 anywhere you go. And that's going to be the comprehensive outpatient rehab facility, outpatient hospital, and specialist office. And then if you're out of network, it's going to be a 50% cost. Pulmonary rehabilitation. Again, this designation of pulmonary rehabilitation, we don't even see that in the other plans. This is significant to what Humana offers. Again, I think it's a nationwide, because it's a nationwide plan. We do see this pulmonary rehab needing to be offered in the plan. In certain states, we're going to see more pulmonary rehabilitation that's needed, especially in the coal miner states. So, and the Humana is represented there. So we have pulmonary rehabilitation, and that is outpatient hospital. It's only $20 copay. Specialist office is $20 copay. And then we have the 50% cost for the out of network. Speech therapy across the board, whether you're in the rehab facility, outpatient hospital, or specialist office, it's going to be $30 copay. And then we have a 50% cost outside of the network. Supervised exercise therapy, which is SET, and peripheral artery disease therapy, PAD, those are only $10. So that's really important to know. And it's also important to know when you ask for physical therapy or you're assigned physical therapy to ask them, could I also have supervised exercise therapy? You always want to see if those two things could go together. That way you could possibly get a longer appointment, possibly, or you could get more appointments more frequently if they offset that, if that's part of your plan of care. And again, that's unique to Humana, that they have so many offerings for therapy. But again, they're representing the whole country at that point. Okay, so now we get into fun stuff. This is on page 21 of the plan of care and your outline of your schedule of benefits. More benefits with this plan. Enjoy some extra benefits with this plan. This is a summary where we cover, and it doesn't list every service that they cover or every limitation or exclusion. This evidence of coverage provides a complete list of coverage services, and you can find that complete list. Here you go. This is where you find all the fun stuff about Humana. Oh my gosh. There's so much stuff on here. Oh my goodness. It's amazing what Humana does. So humana.com/plan documents. Again, humana.com/plan documents to view a copy of your EOC, and that's your evidence of coverage. So this schedule of benefits is what's shared from the broker's perspective, the agent's perspective with you, and then Humana goes even deeper into the evidence of coverage. So here are the three things that are really important. Travel coverage. The PPO National Network gives you in-network coverage across the country. We talked about that at the beginning. So you can see any doctor who accepts the plan's terms and conditions. You'll be able to travel with ease and split your time between locations. Visit humana.com or contact customer care on the back of your ID card if you need help finding an in-network provider. Now, when you travel across the country, you have that availability to see any providers. When you travel outside of the country, you have emergency care and you have urgent care. And I'm urgently reminding you that you need to have more coverage than just your plan. For example, I'll use an example. We have used IMG Global in the past through my agency, as well as GeoBlue. I have a client going to Nepal, and she leaves January 30th through February 18th. And she said, Diane, do you see any reason why I should probably have some more coverage while I'm in Nepal? I said, are you going to be in the Himalayas? I said, it makes Pikes Peak look like a little hill. And I said, have you stocked up on all of your fluids and your water? I said, are you ready with your B12? I said, have you prepared yourself? And she said, well, I'm not so worried about that. She said, I'm worried about if I slipped or, anything, if I broke something. And I said, yeah, I'm a little worried about that too. I said, let me tell you the scenario. The scenario is if you break your leg on Friday, it's very difficult when you're out of the country to guarantee that someone is going to be in the office to pass through that approval of setting your leg in another country before Monday morning. So you might find yourself trying to wait to get an approval over the weekend when your leg could have been set on that Friday. And she goes, oh my gosh. I said, yeah, I watched a whole presentation on this and thought I had no idea this could happen, but it could. So what I'm telling you is she was able to get a repatriation back into the States. She was able to have coverage that would save her if that scenario did happen. It would be an approval immediately on a 24/7 line. And she was able to get it for like $154. And if you put the two side by sides, the two experiences side by side, one that had just straight Medicare and one that had that trip insurance for health, it's a savings of about $40,000. So she said, send me the video that explains this. I said, okay. So I sent it to her and she calls me back like 10 minutes later. She goes, okay, here's the check. So anyway, I'm not getting rich off of it. It is just so you guys are protected and have a good time if in case you want to go to the Himalayas, or another client of mine who's in Africa. So that has this coverage, and another client that's in Italy that has this coverage right now. So if you get that wild hair, we got to make sure that all the wild hairs are covered. Okay, so we have the Humana Well Dine meal program. Humana was the first company to come up with this meal program. And it came out right before COVID. So I can remember my Humana broker leader calling me and saying, Diane, we've got all these extra meals that we thought people were going to be coming out of the hospital. And he said, do you have anybody that needs meals? And I was able to call all of my Humana members and say, would y'all like meals for 14 days? Humana wants to send you meals, because they had all these extra meals the first year that they were really getting into this Well-Dine program. So how it works is there's a zero copayment for Humana Well-Dine. You just need to remember this program. And this is something that Courtney and I are going to be going out to the social workers in the St. Louis area and letting them know this program exists, because they don't really even know. They have so much, as Courtney said, she's like, Diane, they have so much going on. They're pulled in all different directions all the time. They don't know about these programs. And I said, okay, we've got to make sure they know about it. So you guys are aware of it. It says after your inpatient stay in either a hospital or a nursing facility, a rehab facility, you may be eligible to receive 2 home delivered meals per day for 7 days, up to 14 meals. And meals must be requested within 30 days of the discharge from your inpatient stay. So it's limited to 4 times per year. So they have parameters on there, of course, but then there's also, special situations that they'll grant it if they're able to grant it. But that's how the program works, and it's fantastic. And actually, I have tried these meals, and they are good. They kind of taste like Lean Cuisine. So, I can handle it. And it's better than not having anything. So the in-network provider must be used for this service. And if you choose to utilize another provider, you're responsible for those charges. But again, if we find that this isn't a program that's going to work, we can usually go into the community and see, okay, is there Meals on Wheels? Is there another program that might come from the Aging Ahead Association through Missouri? Those kinds of things. We can look for that for you as well. And then over-the-counter mail order, $75 quarterly. Use it or lose it. So use it, and you can use it now. So $75 quarterly allowance to buy approved over-the-counter health and wellness products available through our OTC mail order provider. Unused amounts roll over to the next quarter and expire at the end of the plan year. And quarterly allowance amounts are available to use at the beginning of each of these months. We're in January, it's open. And April, July, October. Limitations and restrictions will apply, and the in-network provider must be used for this service. So again, when I was saying CenterWell at the beginning, that's what you want to use. So let's go back to that so you can have that one more time. And that number, if you want a printed catalog, is 1-855-211-8370. All righty. And if you want to see it online, you go to HUMA.NA/about OTC. HUMA.NA/about OTC. Okay, so some of those other things that you get. This is awesome. You guys are going to love it. Okay, Silver Sneakers Fitness Program. Live healthier, more active through fitness and social connection at participating locations and online. The in-network provider must be used for the service. If you choose to utilize another provider, you're responsible for all charges. If you want to nominate a gym, you can do so through Silver Sneakers. You go to the Silver Sneakers website and you nominate that gym, or you can call them and say, are you in negotiations for adding this gym? The other thing you want to do when you go on the Silver Sneakers site is you want to enroll in Sage Scholars. So if you go 7 times a month for the whole year, even if you go in there at 8 o'clock in the morning, you go have a donut and then you walk out, that's okay. It counts. The steps count. And see your friend. What happens is if you're enrolled in Sage Scholars, those visits that you made each month, up to 7, at the end of the year, it'll total $1,000 in points, and you can roll that $1,000 over into a scholarship for yourself or anyone in your family. It is fabulous. It's like free money. So I have a client that's like, can I go back to school? I said, yes, that's my dream, to be in school all day long. It is actually my, if I won the lottery, everyone's like, Diane, what would you do? I'm like, go back to school. Go learn something new. They're like, what would you learn? I'm like, oh, I got a long list. So you too could go back to school. So she's going back to school. This is so fun. So she says, Diane, can I use it? Because she goes, in a year, she said, my son is going to have a foreign exchange student. And I'm like, your son? She said, my grandson. I'm like, I'm like, that's what I thought, your grandson. I said, what do you mean? She said, well, they only live 4 houses away, and he's going to be speaking Italian. And I said, oh, so you don't know Italian? She said, I will be learning it with the scholarship program. I said, you sure will, girl. You go. So it's kind of fun. So anyway, the other one that is just awesome is the rewards and incentives through Go 365. This is really a program that only Humana has, because it's a complete eligible healthy activities under Go 365, like preventative screenings and exams, and you get rewarded through Go 365 Plus. So when you go on to that website for Humana, you can go into the search bar and you can put in Go 365, and you can get that information about it. And it is phenomenal, because when you put it in there, it's not just points, it is points that convert to dollars onto gift certificates and cards. So you might find gift certificates for Kohl's, or you might find gift certificates for Home Depot. A couple of years ago, we all kind of packed together who all had Humana, and I said, okay, everybody, the first gift certificate that you get Ruby Tuesday, and then we'll all meet on a Saturday morning and have a brunch at Ruby Tuesday. So there was like 21 of us that all met at a Ruby Tuesday and all had lunch, and then they came by and asked for the check, and we all just gave them our gift certificates. We're like, here you go.
Yeah, right.
And we tipped them really good. So it makes it really fun, especially, with your friends that have Humana. You can say, let's both get the same thing. We'll have a shopping trip to Home Depot or wherever. So it's kind of fun. Okay, so a little bit more. If you need help finding a doctor or pharmacy, you can see the plans in the pharmacy directory or on the website. Again, the website for pharmacy is also humana.com/find care. Now, there are, you can see the ratings so that you can make informed choices about the health care that you have. And you can see the measurements of the doctor's clinical activity and cost efficiency. If you ever want to see that about a Humana doctor, that's incredible that they make it available to you. And it is humana.com/care highlight.
Weren't you busy taught me how to do this? I cannot remember why. They sure did. Okay.
Are you asking me a question? Or are you just talking? Okay, talking. Okay, so then also, if you want to see the plans drug guide on the website, you go to humana.com/Medicare drug list. And this is all found on page 23. Now, every year, people ask me, Diane, how do you come up with the information for the education classes? And mainly, I go to several conferences. One is NABIP, and that's the National Association of Benefits and Insurance Professionals. And then I also go to a conference called Miss Medicare that I meet with about 200 other brokers. But NABIP will provide several updates. Right now, I'm on the LEDGE community, the LEDGE council for Missouri, and I hear all
Yeah.
about what we're voting on for healthcare in Missouri. And then as a PAC of NABIP, the National Association of Benefits and Insurance Professionals, we're able to vote together how we feel about the different bills that are being considered. And that's while everyone is in session for Missouri. So that happens every Friday at 2 o'clock in my life while everyone's in session. And then I'll be in Washington, D.C. in February on the 23rd with 1,000 other agents talking about issues for y'all, about how I can do my job better for you, and we can do a better job across the country, and the government can help us do that better job for you. So I'll let you all know what that one sheet is. We all put everything into a one sheet. It's one piece of paper. And when we go in and we meet with our legislature, all our legislators, it's one where we go through that sheet within about 15 minutes. And then they can see what bills are going to support what we feel is going to be the best moves for healthcare in this next year and the year after. So that's where I get a lot of my information from NABIP. I get a lot of my information from Miss Medicare, because Amanda Bruton, she has a company that's called Medicare Answers, and I'm not affiliated with that company, but she provides education, and she's also on the national team for brokers and represents Medicare on that particular team. So, and then I get a lot of information from Integrity, the company I am associated with, and a gentleman by the name of Chalon Jackson, who happens to be the Missouri president for NABIP. So we're all of us in the industry kind of know everybody in the industry, and they fill me with all of this information. But there's one piece of information that comes out to y'all every year, and that is the Medicare and You book. And I scroll through that book and look at everything I possibly can. And if you don't have a current Medicare and You book, you can view it online and by going to medicare.gov. And then, or you can even call Medicare at 1-800-Medicare, and you can ask for a Medicare and You book, but it should be sent out to you every year. And it's all the updates of Medicare every year. And then in my class, I just condense it. Now, another way to do it, and Edith always says, oh, Diane, you just say, click here, click there. Well, yeah, I'm a clicker. So what happens is you can go onto Google and you can enter Medicare and You 2026 PDF. Boom, it's right there. It comes right up, and you can just download it. That's the easiest way that I've found to do it. So, okay, so a couple of things. If you ever have anyone that you know that needs to have this translated into another language, we can translate this into almost 50 different languages. So, so just let me know, and then you can know. Now, as far as the drug guide goes, again, I'm going to mention Centerwell, and you can go to humana.com and /pharmacy. So you can see what your options are for the pharmacy. And you can see who's in network and who's out of network, especially if you're traveling and you have to get a medication filled. Here I am under 65, and I went to a pharmacy assuming that they were in network. Holy moly. They wanted to charge me 4 times as much. And I said, I know what that pill's worth. That's not it. So shame on me. I didn't check it. So always check it. And then also, it's one where you can, if you have a My Humana account or plan to create one, you can go in and you can sign in and create one. And this is how you do it. Go to account.humana.com. And then once you're signed in, so you're going to go to account.humana.com. And once you're signed in, you're going to use the search bar at the top right of the page and type in a give shared access, and then you just follow the instructions. Now, you don't have to give shared access. That would be if you wanted to share your screen with me, but you don't need to. What you're going to do is just create an account.humana.com. And I would say, don't give anyone shared access. Protect thyself. So, so that kind of concludes everything as the deep dive. I've given you a ton of information. Now I'm going to open it up for questions. So, what do you guys really, really, really want to know? Well,
You've already answered all my questions.
oh, okay,
Just
great.
listening.
What
Yeah.
was your aha moment? What was the moment when you went, "Oh, this plan is good. I did a good job. Yay, 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 me."
Well, I think it was the travel part, just like I'm going to stay within the United States this year, but that's kind of why I left Essence because I thought, oh, what if something happens and I'm not here at home?
Right,
I
right.
wanted better coverage, outside
Absolutely. You can go
our
see a
area.
doctor, you can go see a specialist, that kind of thing, instead of just emergency medicine.
Yeah,
Yeah.
yeah, yeah.
Yeah. Good.
And
I'm so
just
glad you're on the call. I'm so glad you're on the Zoom. Thank you. So,
yeah, me too. Thank
yeah,
you so much.
thanks
I
for
do
being.
have to get going though. My daughter's here.
Okay. Okay. I just want
Uh,
to hear quickly from everybody else.
okay. Thank you. Thank you.
Thanks so much.
Bye.
All right. Bye, Charmaine.
Bye. Bye.
Diane, I put in a comment, what is Courtney's last name and contact information? Because it sounds like she's going to be essential for us as well as you and Edith.
She is essential. So Courtney's best way to reach
Uh,
her. Do you want
We're
to?
gonna put it in the chat.
Okay, Courtney's gonna put it in the chat.
okay.
Okay, great.
Cool. Sorry, that was my fault for not checking the chat. I'm sorry.
That's okay. And my other chat questions got answered, I think. And I do
Okay.
have some things I need to talk to you about personally with some surgeries coming up, but
Oh, okay.
I won't keep everybody online for that.
Okay. So we'll just know that we need to call you, Courtney. I'll have her call you tomorrow. So if that's good for you.
Yeah.
Okay, awesome. And we'll talk about all of that.
Hey, Diane.
Yeah.
This, this is Pat.
Hi,
And
Pat.
hi. I'm sorry we got on late. I didn't get the information and it came over my phone. So I don't have any chat features that I don't know what people's questions were. But when we met you for the enrollment, you gave us the HMO booklet and our cards came in as PPO. So we do not have the PPO booklet. If you want to do it online, if I can get it as a PDF, that would be fine.
Okay, yeah. Courtney's going to send to everybody that was on the call today.
Oh, she did. Good.
Yeah, yeah. So that everybody has it.
And
What
she
I
sent an email.
Yeah, she'll send an email.
Send an email. Okay. Make sure I'm on it because somehow we got missed for the call. And so that's why we're late. I would
Oh,
have done
okay.
it on my computer instead of my phone. So I'd have a bigger screen and I could access the chat. But anyway, it didn't happen that way.
That's
The other
okay.
thing, my chiropractor was unsure about the copay, charged a $37 copay. But when I went online today and it says, and like you said, it should be 15, but I think they'll credit to me the next time I'm there.
Yeah.
And then I don't know if Bart needs to meet with you individually, but he had questions about the medical and he just got back. So here he is.
Okay.
Well, I'm just asking about the
Bart.
prescription stuff. Hi. And we went online earlier and I put in for the Walgreens up by our house to get my medicine, but I was going to go ahead and put in for my medicine, but can I just call the number on the back and will they connect
Yeah.
me to the place I need to get to and I can order my medicine through them?
Yes.
Okay. Okay, that's good.
Or you can
So
go
then I
to,
just need my card. I just need my card. And then I also am working, well, not working, but I'm going to our community center on Thursdays to work out on their exercise stuff and everything on
good.
that. And I'm enrolled on that, but I can only make it on Thursdays right now. I'm trying to make it more days later, but right now it's just on Thursdays.
Okay, that's
Okay.
good. That's really good. Well, definitely sign up for the Sage Scholars and see what you can do. Because if you get to the gym more than just Thursdays, 3 more times, then it sounds like that would be a really great program for you to be in.
Okay.
Even if you participate online on classes at home, that sometimes will count as well. So you just need to ask
Oh, okay.
your speakers if that can count. So
Okay.
you
I
can
do get
also
some information from Silver Sneakers on doing stuff online, so I didn't know that. Okay.
yeah. They do have
Okay.
classes that are online. I've done one. The funniest story I will just tell you guys here is the hilarious. I told one of my clients, I said, you really do need to take your doctor's advice and start working out. And so she called me and she goes, Diane, I'm doing yoga and Tai Chi. And I said, you are? She goes, I'm doing it 3 times a week. She went from nothing to 3 times a week. And I said, where are you doing it
Wow.
at? She goes, I'm down at Forest Park, and then I'm in a place in Clayton. And I said, who's the instructor? And so she told me who the instructor was. He's gorgeous. So it's motivated her.
It's not the exercise, it's the person who's running it.
Right. And he does these different classes around Midtown. And I was like, that's hysterical. So anyway, whatever works, whatever gets you moving, right?
Yeah.
Oh my
Well,
gosh.
they said that sometimes you can do it without you can do it anytime. I guess they got some
Right.
kind of.
Anytime. So definitely log in and get your points so you can do the Sage Scholars because that's fabulous.
Okay. Okay.
Cool.
Okay, great. Okay, and then Pat, I know other Pat is on here, Pat Shown, and then also Joyce. So what were your aha moments?
We are particular to the like the first lady, the travel, because we do travel quite a bit. We're in Georgia a lot, we're in Florida a lot. So that being able to use a doctor there
Yeah,
is big, where most of the other programs I don't think had that.
right. Exactly. Exactly. So yeah, if that is what you're looking for, absolutely this is,
And being able to
9 out
keep
of 10 a fit.
our doctors too. That was a biggie for me.
Absolutely.
I'm very
Yes.
attached to my primary care. He's really done a lot for me. So
Yeah, that's so good. I know
yeah.
once you find somebody you love and trust, it's like, I love and trust you. Don't leave my life.
Yes, don't change insurances, don't do anything.
And then Paige was here with us in person. Paige, what was your aha moment?
Did I get to go back to my old physical therapist?
Oh, that's good. Did you guys hear what she said? She goes, I
Ah,
get to go back to my old physical therapist that I really like.
oh, good.
So that's really good. Yeah.
Just, I'm so excited now.
Oh, that's good. Good. She likes how comprehensive this was, and she feels much more comfortable. Yeah, it's interesting how much emphasis Humana puts on therapy, and that they put the emphasis on go to the chiropractor, go to the acupuncturist, make sure that you're getting what you need to rehabilitate. So, which is great. And a lot of the social workers at the hospitals, they don't know the comprehension of their commitment to therapy. So, which is, and their commitment to wellness with that Go 365 program. I mean, they're really trying to get you to get out there and be motivated, and then have the community with friends that you call a friend and say, oh, you have Humana too? Great. Let's both try and get this, and let's go to lunch for free. So I mean, that's fun. So I like that too. Okay, so Patty Schoen, you're the only one that hasn't spoken. Are you there? She's like, I'm going to be incognito. All right. So with that, anybody want to mention one last thing that they said, oh, Diane, you need to know about this. This sounds really good. Or there's something that you're looking at for 2027 and you're saying, what's coming on the horizon? Do you want to ask me one last question? Or are you guys like, we got it, Diane. We know what we're doing.
I'm good.
Good?
I'm
Okay.
good. Hershey's
Okay.
about to have a fit here. She's trying to get in on the Zoom.
Speak that, but
Where's little Miss Goofy?
Oh, yay.
Yes.
Hershey.
Here's such a baby.
You're good
She
girl.
is now, this one is now a graduated certified therapy dog.
Yay!
So we have two now.
Fabulous. That
Yep.
is
We went to
awesome.
the library yesterday.
Oh, yay. Fabulous. I love
Yep.
it.
Yep.
That's good. We might have to have Hershey at a yappy hour.
We can do
Yay.
that. We
Yes,
can
we're
do that.
gonna
We can bring Emma and Hershey.
we're noting that we're going to do that.
Okay. Okay, cool.
That
They would
sounds good. Oh my gosh. Well, I will tell you guys what I'm looking forward to this year is all the calls that you guys send me of your friends. I love them. I mean, because y'all are awesome. And I will tell you, this is what was so funny. I was in the office during open enrollment, and of course, everything crazy was going on. Edith was just stacked with, a stack of stuff that she had to do. And Courtney is like trying to go, what's going on here? What are we doing? So all of a sudden, one of our clients came in and he's adorable and so kind. And he brought a stack of receipts. He goes, I just wanted to see the girls. And I'm like, oh my gosh. And he was just so cute. And so when he left, one of the other ladies that works in the Berg office on the bigger team, not on my insular team, she says, golly, Diane has the nicest clients. Every single one of them is wonderful. And I thought, she's not going to tell
Aw.
me that to my face, but I heard it. And I turned around and I said, you betcha they're wonderful. They're awesome.
We
So
think the same about you and your whole team.
oh, thank you. Well,
Courtney and yeah, we just
he's so cute.
now they're both up here.
He's
It's
like,
like, you
love
can't
me,
win.
love me.
Yeah. They need their lovin's.
That's awesome. That's awesome. Well, we love you guys. So we are looking forward to this summer. We are going to do it again. We're going to have save the date on July 5th, and we're going to
We're
try
out
and
of
find a
town.
place and get together. And then, of course, we'll have the classes again in the fall and all of that stuff. And Eddie goes, "Am I still going to be the caterer and getting all the goodies?" I said, "Yeah, baby, you are hired."
Thank goodness he just fits right in.
He does. He does. He's so awesome.
Yes,
So
yes.
anyway, I just wish you guys a wonderful, happy, healthy year. And we're here for you. And we love serving you. And we love what we do because you guys are part of it. So with
Thank you,
in our
Diane.
lives, we look
Thank
forward
you
to
so much.
2026. My pleasure from the bottom of my heart. Mwah.
Mwah.
Thanks,
All right.
Diane.
Bye now.
Bye-bye.
You're welcome. Bye-bye.
And Pat, quick question.
Yeah.
You said something about having health insurance. We are considering taking a 5-day trip to Mexico for a pilgrimage.
Oh, nice.
Would that, how expensive is that kind of coverage?
It's not. It's really not. We just had a client go to Nepal for 2 weeks and it was $154. So it's very
For
inexpensive.
Nepal.
Yeah. So I'm sure that would be, it's a smaller, it's a shorter time of a trip and it's not as far. So it's touching the
Right.
United States. So it's probably going to be less than that. So, but we can run the quote.
Okay.
Do you want me to have Edith call you tomorrow? And we can run the quote for
I'm
you?
trying to think. Well, we haven't quite decided yet.
Okay.
Bart's been seeing a knee doctor, and we haven't made the decision about Mexico. Let me contact you after we find out what his knee doctor says.
That's awesome.
And we'll go from there.
Yes, absolutely. Tell me exactly what they say about the knee. So that way we know if we need to do international insurance or we need to get more insurance here. And we'll go from there. I hope his knee's okay. Crossing my fingers.
All right.
I hope you guys get
All
to
right.
go. That's awesome. All right. Take
All
care.
right. Thank you.
You bet. Bye-bye.